father of 3 children and resides in Delmar, New York.
Thank you very much. I will try to be very brief. John, thank you for exemplary patient advocacy. What a wonderful speech. Thank you. I have a colleague.
Put the mic closer to your mouth.
Here from Colesville who reminds me of days when I was first out of medical school, and I drove a patient from Colesville to Cooperstown to the emergency room. She had an acute illness that needed intravenous therapy and was likely to end up in the ICU. But she explained to me that she had this happen before and it cost her $1,500 out of pocket, and she didn't even have a full-time job or health insurance at that time. And in those days in Colesville, again and again, I would know that there was a certain test or a certain medication to prescribe, but I would have to first know how the patient was going to pay. How the patient was going to pay. It intervened in every visit. It ultimately intervened in every single visit. And this is an intolerable way to take care of our fellow human beings. We cannot have a society in which money trumps our ability to practice state-of-the-art medicine. And so I started studying about what would really change things for the better. And we all believe in incremental change. Gentle progress is what we have been told is the watchword. And we've also been told that the elections come, the elections go, and the windows open and windows close. Well, Marie Gottschalk is a professor at the University of Pennsylvania, and she has a compelling article, and I got to hear her speak in New York City. And what she says is that when it comes to health reform, the people of the United States suffer from the Stockholm syndrome, where they so identify with their captors that they wouldn't jump out the window if it was wide open. So what we had this year was we had a bill in the House and a bill in the Senate that was written by the insurance companies. In November, immediately after Obama was elected, the insurance industry put out a press release. They said that we think we should do away with pre-existing conditions. That's a terrible thing. We think that there should be guaranteed issue. We think that we shouldn't charge women twice as much as men. We shouldn't charge the elderly 10 times more than the young. And we think we could have some reform if only the government will force people to buy our product. That's what the insurance industry put on the table. And that's what they did in Massachusetts in 2006. And I think that Massachusetts, the Copley defeat in Massachusetts is a very interesting moment because it's an image of how far away the people have gotten from the ones who would represent us right now. In Massachusetts in 2008, obscured by the Obama victory, was a voting proposition in 10 districts, 10 voting districts in Massachusetts. The voting proposition said, should the elected officials of this district oppose mandates to force people to buy private health insurance and instead advocate for a single-payer Medicare for all style reform? That was a referendum question in 10 voting districts in Massachusetts. 180,000 people voted, and 73% voted yes. 73%. An overwhelming statement. This is not a poll question done by Roper or Gallup or somebody. This is a ballot initiative in the state of Massachusetts. And so when the Senate election comes up for Senator Kennedy's seat, the people of Massachusetts want single-payer reform, and who will advocate for it? The President of the United States, formerly eloquent, passionate advocate for single-payer reform, absolutely understands the question. And today, where is the President of the United States? He's open for suggestions. So this is the kind of moment that we're in. What we need to do is to press ahead with confidence. Now, what I would like to submit is that when it comes to changing our health system for the better, the very least that will work to make things better is single-payer national health insurance. It is the minimum increment of change that is required. Because in state after state, reform has been tried based upon the private health insurance companies. It's been tried in Minnesota, in Oregon, in Tennessee, in Maryland, in New York, in Vermont. Again and again and again, reforms based upon the private health insurance companies have failed. Over 25 years, they've failed again and again and again. And right now in Massachusetts, what did we find? But an article by the treasurer of the state that the insurance mandate in Massachusetts is bankrupting the state. It cannot stand, it will not work, it cannot last. It does not save money, it does not cover everyone, and the quality of care in Massachusetts has not improved. It is not health reform to make people buy health insurance. And that's what we've learned from Massachusetts in state after state. state. So what we need most of all is the courage of our convictions. And I would challenge you here that we begin to think of single-payer Medicare for all, not as a progressive idea or a left idea, but as a centrist demand. Because is, after all, health not the foundation of individual freedom? How can you be free to travel across the state? If I wanted to drive, say, over to Ithaca, I would drive across an enormous underserved area where their hospitals are really having a struggle, where there are no good clinics. And if I wanted to be free, wouldn't it be my responsibility, my individual responsibility? I'm not talking about paying for someone else. To live in a society where there's a healthcare infrastructure. And isn't healthcare in the modern world, when healthcare is so expensive and so necessary to all of our lives, isn't it the proper discussion of the republic, of the democracy, before the people? What is the healthcare infrastructure that we want to have for ourselves? This is very consistent with the Ronald Reagan conservatism that I grew up with and detest. Think about it. This is our personal individual responsibility. And if you want fiscal responsibility, the United States now spends nearly $8,000 per person on healthcare, twice as much as any other country. Half of the dollars that go for healthcare in the United States come from government sources. The United States spends, think about that, twice as much as any other country, half coming from government sources. We are paying for national health insurance and not getting it right now. And so if we want to have a fiscally responsible way of paying for health care, the way to make it affordable is everybody in, nobody out. It's simple.
Yes!
So thank you, Capital District Alliance for Universal Healthcare, co-sponsor. Thank you, Labor Campaign for single-payer healthcare. We have some of the steering committee members here. Physicians for National Health Program, our organization, we have flyers. You're welcome